Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Have you ever noticed that your fingers or your toes, especially when it's cold out or you're in a heavily air-conditioned room, seem to turn a bluish or a purplish color and become very cold? Then you may be one of millions of Americans, and as well as people worldwide, that have a condition known as Raynaud's phenomena, and also known as Raynaud's disease. Essentially, this is a benign condition that involves the small blood vessels that course through the fingers and the toes. The body has a great way of regulating temperature in that it forces blood vessels to open and close in order to release the heat of the blood out through the skin. When there is certain stimulus such as cold temperature, the body will open less of these blood vessels, and in fact will restrict some of the smaller arteries in the areas sort of on the outer aspect of the body, such as the fingers and the toes, in order to preserve more of the body heat towards the core of the body. Well, in Raynaud's disease, or Raynaud's phenomena, what eventually happens is that the body sort of goes haywire in that how it restricts the flow of blood into these small blood vessels, and actually constricts the diameter of these small little arteries too much in response to the stimulus of the cold temperature. This basically blocks off some of the circulation going towards the fingers and the toes, and ultimately causes them to become colder and also have more of a blue or purplish discoloration. Now, the circulation in and of itself is still adequate for the tissue of the fingers and toes to be able to stay healthy and function fine. But in certain very severe circumstances, this disease can cause too much constriction of the arteries, and sometimes pain can occur as a result of the fingers and toes not receiving enough blood flow in order to stay healthy. This is fairly uncommon, but it is present in some more advanced and complicated cases of having Raynaud's phenomena or Raynaud's disease. In general, there's not a whole lot you can do to protect against this constriction. As I said, it is usually fairly benign. It doesn't necessarily cause any pain, but it is something you will visually notice, in that the fingers will be and toes will be different color and will also feel colder to the touch. By making sure that you avoid exposure of your fingers or your toes in cold environments, such as making sure they're well dressed and good warm socks on during the winter time, and also during environments in which you're sitting in a heavily air-conditioned room, the amount of constriction of these blood vessels can be controlled to some degree. There are certain topical medications that can be used that can help to open up the blood vessels, but those do need to be monitored by a physician, because they can have a certain effect on the rest of the general circulatory system, given the nature of how these medications affect the opening and the closing of the blood vessels themselves. But in general, this is a benign condition. It's simply something you cosmetically notice. But in more serious cases, it can cause some pain, and in the absolute most serious cases, can also cause lesions to form on the skin itself, because certain small areas of skin might actually die due to the lack of blood flow. But this is fairly uncommon. Well, I hope you enjoyed this video. Look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.